Hi all, how are you? Welcome to Zen with Shifana. Today we are learning anti-hypertensive drugs in just 4 minutes. See this line? BP is equal to calm horse because high BP means tense horse. Drugs make it calm. Save this video for your future Viva and let's get started. First class would be AC inhibitors where the suffix is PRIL, example Enalapril. The dose would be 2.5 to 20 mg, usually given in twice a day. And if you see MOA of this in my doodle, the angiotensin 1 that converts into angiotensin 2, the AC inhibitors blocks the AC enzymes. So less angiotensin 2 made blood vessels stop tightening. So BP becomes down. That's why we write stop tight. The side effect would be dry cough, very common in exams. Why? Because ACE also breaks bradykinin. So remember, PRIL is equal to enalapril that causes dry cough. The second class would be ARBs, that is the green box. ARB angiotensin receptor blocker. The suffix would be SARTAN. Example Losartan. The dose would be 25 to 100 mg once a daily. And if you see the mechanism of action, the angiotensin 2 is bad signal, right? So the ARB blocks the AT1 receptor with a shield. So even if angiotensin 2 is made, it can't act. So it blocks bad signals. What would be its side effect? It is increasing the potassium. Is it bad advantage that it has no cough? So, quick exam trick. If patient got cough with enalapril, switch to Losartan, right? So, the third would be calcium channel blocker. The suffix will be right for this will be DIPINE. Example Amlodipine. Dose would be 5 to 10 mg once a daily. The mechanism action is see this artery with calcium. The calcium channel blocks calcium entry. So less calcium is equal to vessel relaxes, which relaxes the road where the BP falls. Side effect will be ankle edema, leg swelling, which has very high yield. So dipin is amlodipine where the police stops the calcium cars that may cause the ankle swelling. The next would be beta blockers. The suffix is ol, example metoprolol. The dose would be 25 to 100 mg. The mechanism of action would be blocks the beta 1 receptor in the heart, so it decreases the heart rate, it decreases the force. So heart beats slow plus less force will be there. That's why doodle is owl sleeping. Yeah. So next would be side effects. That is the bradycardia where the heart rate becomes too slow. Remember, owl is metoprolol where the owl is sleeping. That means the slows the heart. The last class will be the diuretics. The suffix is "-ide" or "-mide". Example Furosemide. The dose would be 12.5 to 25 mg once daily. In this, the MOA would be the kidney reabsorbs sodium plus water, and diuretics reduces the reabsorption. So remove water like watering can, less water in body that causes the less BP. The side effect would be hypokalemia, which goes down of the potassium. So MIDE is furosemide, where the kidney plus water can causes the hypokalemia. And most important for exam will be drug of choice. So pregnancy, if there is pregnant woman, will be giving metoprolol about 250 to 500 mg, which is safest in pregnancy. If patient with DM plus proteinuria, will be giving enalapril 5 mg, where the ACI protects the kidney. For post-MI heart failure patient, will be giving metoprolol 25 mg plus enalapril, both protects the heart. For the elderly, we'll be giving chlorthalidone 12.5 mg or amlodipine 5 mg. as it works well in old ages. So five classes: PRIL, SARTAN, DIPINE, OL, IDE or MIDE is done. Which class mnemonic helped you most? Comment PRIL, SARTAN, DIPINE, OL or IDE. Share with your family page mate who has Viva tomorrow. This is Shifana, Zen with Shifana. See you in the next doodle. Bye.